Acute retropharyngeal abscess. Etiology. It is commonly seen in children below 3 years. It is the result of suppuration of retropharyngeal lymph nodes secondary to infection in the adenoids, nasopharynx, posterior nasal sinuses or nasal cavity. In adults, it may result from penetrating injury of posterior pharyngeal wall or cervical esophagus. Rarely, pus from acute mastoiditis. Tracks along the undersurface of petrous bone to present as retropharyngeal abscess. Clinical features. 1. Dysphagia and difficulty in breathing are prominent symptoms as the abscess obstructs the air and food passages. 2. Stridor and croupy cough may be present. 3. Torticollis. The neck becomes stiff and the head is kept extended. 4. Bulge in posterior pharyngeal wall. Usually seen on one side of the midline. Radiograph of soft tissue. Lateral view of the neck shows widening of prevertebral shadow and possibly even the presence of gas. A contrast-enhanced CT shows the extent of the abscess and also if it extends below the hyoid bone. Any associated abscess, for example, of the parapharyngeal space, may also be seen. Treatment. 1. Incision and drainage of abscess. This is usually done without anesthesia as there is risk of rupture of abscess during intubation. Child is kept supine with head low. Mouth is opened with a gag. A vertical incision is given in the most fluctuant area of the abscess. Suction should always be available to prevent aspiration of pus. If done under general anesthesia, care should be taken that the abscess does not rupture during intubation with aspiration of pus. The pharynx is always packed. Aspiration for an abscess can be done before incision to break the pressure in the abscess and gush of pus. Systemic antibiotics. Suitable antibiotics are given. 3. Tracheostomy. A large abscess may cause mechanical obstruction to the airway or lead to laryngeal edema. Tracheostomy becomes mandatory in these cases.